Are we the county executive?
I was expecting.
Okay, we will wait.
Not hear otherwise.
Okay, I didn't either.
One other thing too, Ashley. That's great.
All right, good morning to everyone. I will call the meeting to order. In looking at the attendance, we have everyone here in person. Appreciate your attendance this morning. Note the meeting has been properly posted by the clerk's office. We will begin with a moment of silent prayer followed by the Pledge of Allegiance. I pledge allegiance
Of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
First order of business on the agenda are a review of the minutes from our October 22nd meeting. Those minutes were posted in the packet. Looking to see whether there are any corrections or discussion of those minutes. In the absence of same, the minutes will stand as posted. Any corrections, comments? Hearing none, the minutes will stand as posted. Thank you. Then we will move on to our discussion or possible action items. I will welcome back virtually our partners from Justice Management Institute. We have Amy Wickman joining us again, welcoming Amy back. She has also brought with her Gabrielle Hillman, a program analyst from JMI. They are appearing with us virtually this morning to launch our strategic planning efforts. If we circle back to our prior October meeting, we all engaged in priority setting. We also agreed to continue our partnership with JMI. Want to thank all of those involved in securing additional funding from the county to facilitate the grant we received from JMI. Thank JMI for their partnership in that regard. And Amy, I will turn it over to you.
Great. Thank you so much. Hi, everybody. Can you hear me okay?
We can. Good morning.
Great. I have been having internet problems the last couple days, so hopefully that doesn't happen today. All right, I'm going to share my screen. Okay. Can everybody see that? Okay.
We're good on our end, Amy. Thank you.
Okay. Great. All right. Well, I'm really excited to be here today. I'm sorry I'm not there in person. I promise Gabby and I will be there eventually in person, but it's nice to be here with you today, even virtually. It's been a few months. In case you don't remember, I'm Amy Wickman, the Justice Management Institute. Um, and I'm so grateful to be back here. And honestly, I thought you would be doing the strategic planning effort on your own. And I wanted to set you up being ready to do that, but it is such an honor to be able to help with this process. So I'm really excited. And before I jump in any further, I want to let Gabby introduce herself. She is going to be my partner on this project. I think she's truly going to be critical to putting together a great plan for you guys. So Gabby, you want to just introduce yourself?
Yeah, thank you so much, and thank you for having me. I'm Gabby Hillman. I'm based in Chicago. I'm originally from St. Louis. I've worked as a program analyst with JMI for about 3 years. My focus is usually on research, but also with CJCCs. Very excited to start this project. My background, I'm a licensed social worker, and prior to working at JMI, I worked in sentencing mitigation and then domestic violence legal advocacy. So a little bit about me, and I'm very excited. So thank you for having us.
Thanks, Gabby. And also before I start, I can't see you all very well. So if there are any questions or anything, please just like stop me, say something. It's hard to read the room looking at a screen. So please just jump in anytime. And before I go to the next slide, I just wanted to ask you guys how you feel about strategic planning. Like who's done strategic planning before in this group?
I'm seeing all the heads nod. I think I'm on, Amy. I'm seeing all the heads nod or all the hands go up. So I think everyone
Okay.
has done it in some capacity here at the table.
Okay, great. And how many of you absolutely hate it?
Lots of smiles and laughing.
Okay, good. Okay. I know that is how most people feel. I swear we will try to make this as painless as possible, maybe even fun. We'll see. But honestly, we've had a lot of great experience with this process with CJCCs. I think most people are used to doing strategic planning with their own agencies, and this is a little bit different, and it's kind of unique to think about the system as a whole and think outside of your agency and kind of work together with folks you don't usually work with. So hopefully you'll enjoy it. Hopefully it won't be too awful. But today I'm going to kind of explain the whole process and then tell you a little bit about the mini assessment I did. So I'm going to try to keep this presentation brief. I know you guys have a lot more to get to today. So I'll try to be quick, but please stop me with questions. And also I'm always available by email or phone if you have questions after this and just want to find out more. So the original opportunity that JMI was offering was a matching award to assess a CJCC and provide recommendations for a path forward. Four other councils received the same award, including St. Croix, Wisconsin, St. Croix County, Wisconsin, which is Hudson. So we are just kicking off our project there as well. So I have a couple reasons to visit Wisconsin this winter. But since I've already worked with you all and I know about your council and also your council is very new, it wasn't really the right project for your group. And so we wanted to do something a little bit more meaningful for you. So after talking to the judge and Brad, we realized that doing strategic planning was a much better fit. So our goal for this is to provide a mini version of that assessment that we're doing for other counties. And I'm going to do that today. And then to help you develop and adopt a strategic plan based on the 3 priorities from the report that I did earlier this year that you talked about at the October meeting. So this is our timeline for the project, and I don't know how well you can see this in the room. I tried to make it as large as possible. I will send this out after the meeting so you can have it. And I apologize that I didn't send it out in advance. But we aligned the timeline with your current CJCC meeting schedule. So today's meeting is the kickoff and the presentation of the mini assessment. In January, we'll have a survey go out to all of you for your feedback on the assessment and what you want to see for the further development of the CJCC. And then at your February 10th meeting, we will facilitate strategic planning around the first priority, which is strengthening your CJCC. This will give you an idea to like develop an action plan, to provide your direct input, and to see how that whole process works. And that same week of February 9th, we'll convene 2 work groups to focus on priorities 2 and 3. And those work groups will meet 1 to 2 more times throughout February and March. Hopefully they'll just only need to meet once, but there's opportunity for a second meeting if we need it. And then Gabby and I will draft the 3 action plans. And at your April meeting, we, along with the work group members or some of the work group members, will present those action plans and get your feedback on those. And we'll make edits to them. And then Gabby and I will prepare a final strategic plan all pulled together with other information and details, let you review that by email throughout May. And then hopefully, if everything is on track, we will bring it to your June meeting for adoption.
We just pause there for a second, Amy. I just slide, or if you could go back to that last slide, I just wanted to pause there, see if any of the members have questions or comments at this point. This looks like an overview to me, so I want to pause for a second.
Perfect.
And I may have missed it, but I thought we were meeting in the even months. Was some of this stuff taking place I see we've got
Great question.
some odd months in there. Was some of that stuff going to be conducted outside of a meeting? Is that the plan?
Did you hear the question, Amy?
Yes, I think so. So I think you're asking about like January, where it says January and March. Is that right? Yes. So those are just what Gabby and I are doing behind the scenes. So we'll be sending out the survey in January. So you'll have something to do in January, but it won't be the meeting. So in this, I probably should have shown which months had the meetings, but for this, it's just February, April, and June will be the meetings.
Thanks for that clarification.
Absolutely.
You also mentioned the work groups. Amy, if we could just pause here for a second, could you just give us a quick overview of how you see the work groups being assembled?
Absolutely. Actually, I read your mind, and my next slide was about the work groups, just to make sure that you guys have an understanding of it. So I wanted you to start thinking about these work groups, even though it won't be until February that they meet. We anticipate these 2 groups are going to help develop the action plans for the 2 priority areas, which are behavioral health and pretrial compliance. And they're going to be made up of people who have firsthand familiarity with the topics. And we ask that there will be at least 1 person from the council on each work group. So it could just be one of you that serves on each of these, or it could be more than one of you, whatever you decide you want to do. We typically like to have about 5 to 10 people on these work groups. It really depends on the jurisdiction, how much interest there is, and what the topic is, if there's enough people that want to come. So I'm hoping you'll start thinking about whether any of you would like to serve on these 2 work groups, and 2, who you'd like to send from your office. So it could be you and someone else from your office, or just someone from your office that you'd like to participate. But also think about anyone you'd recommend from outside of your office. So for example, for behavioral health, maybe there's a local service provider who you think should be included, or a treatment provider that you think should be there. We'll be asking for recommendations for these. Well, I almost lost power. I live in the country, so I randomly lose power all the time. You guys can still hear me, right?
Yes, you're
Okay.
okay.
Okay. Oh.
We
Okay.
are seeing that happen. So
Okay, well, let's hope we're okay. We're having like huge windstorm. Okay. Where was I? That's so distracting.
that's
Okay.
okay. You were on work groups and asking for members to think of who from their agencies could participate in the work groups.
Perfect. And so then in January, we'll be asking for those names, their titles, and their email addresses so we can reach out to them, or for you to make an introduction, whichever you prefer. And we'll start forming those work groups in January, figuring out where they're going to meet and when, and then we'll have that first meeting in February at the same time that we're there for your CJCC meeting. So it all depends on the availability of the folks who sign up for those work groups. We might have your CJCC meeting and then, throughout the day have the other 2 meetings, but we'll just see how that works out. And then those work groups will meet, like I said before, 1 to 2 additional times virtually. And that's just to follow up. So that first meeting, we'll be talking a lot about what they envision for what they'd like to see in these two topic areas. But then we kind of dig in further about like what the action plan could look like. And even though we'd always love to get it done in one meeting, it never happens, and sometimes it takes more. So we like to allow for at least 3 meetings. And ideally, these work group members could transition into a standing committee for that strategy. Let's say you have the behavioral health strategy and you want to have a behavioral health standing committee. Those work group members could also transition to be that committee plus additional folks. But obviously that's up to them, and it all just depends on what you put into the plan. So any questions about the work groups?
Amy, one quick question. At what point did you say the subtopics within those two work groups would be sorted out? Because it would depend on, I think, some of the subtopics who we would want to be a part of that.
Yeah, great question. So it's behavioral health and pretrial compliance. And these were that along with strengthening the CJCC were the 3 priority areas from my recommendations. And as I understood it, the ones that were agreed upon at the October meeting. If you guys want to change those, I mean, obviously that is totally up to you. So that's just what I have in my head right now. But this is a great time to talk about that if you think those priorities have changed.
I guess what I was referring to is the subtopics within the pretrial compliance and the subtopics within behavioral health.
Oh, okay. Yeah, I haven't thought about those subtopics yet. I think that's maybe something that we could work on. Me and Brad could talk about further and see how we want to work on that with the CJCC members. And I could go back to some of the report items that, and I can kind of like pull together what that would look like. But really, it's up to all of you who you think you would want to include under that, like under behavioral health. And then that group together will decide what strategies they want in their action plan.
Okay.
Does that make sense?
Yes.
Okay. I know these are big umbrellas, like behavioral health and pretrial compliance are very large, but these were the priorities that came up a lot. So hopefully you already have something in mind that you really want them to focus on.
Julie?
Do we know what we want to focus on? I mean, I know that these are the 2 areas that came up, but I don't know what's the one behind them. Like what, do we want to move towards pretrial compliance? Is that like something that everybody's bought into, or is that what the work group to decides upon? And then behavioral health is so big, right? Like what's the area that we're feeling has the biggest focus on? Or again, is that what the work group decides?
So Amy, did you hear Julie's question?
I think I did.
Okay.
Yeah.
If listening to Amy talk through this in a call that we had last week where she was previewing this presentation to me, the impression that I left with was each of the CJC member agencies would have the opportunity to either themselves participate in these work groups or send this idea of subject matter experts from your agencies to participate in our priority areas, behavioral health, pretrial compliance, with the understanding that the focus of discussion will stem from our strategic priority discussion that we have had along the way, with the goal of identifying where are the challenges and barriers that currently exist in Washington County and what strategies are these subject matter experts proposing to us that we consider adopting as part of our strategic priorities. That's really where I see the work groups doing the nuts and bolts discussion and bringing those proposed strategies to us for our discussion and consideration. That's what I think is going to be the meat of the work of these work groups. Amy, am I headed in the right direction?
Yes, I'm so glad you jumped in and said that, because you said it much better than I tried to say it. I'm only on my first cup of coffee. It's not even 6 a.m. here, so forgive me. But you really described it very well. I think we'll use the information from the report to help guide them. They will come up with these ideas and bring them back to the CJCC.
So to answer your question, I as we sit here now, I don't expect us to have a what. I do expect the work groups to come back with strategies to propose to the CJCC to answer the what in terms of the action that they're recommending based on what they identified to be the largest barriers to the concerns and priority areas that we have identified in our discussions on priorities that stem from our report. I see the subject matter experts as being individuals that are in large part in the trenches in these areas from your agencies and can really speak to these challenges and really want to work together with their counterparts in other agencies to have some hard discussions about where the opportunities may exist. That's what I'm seeing these work groups really tackle.
Yeah.
Does that help? Okay.
Yeah, that's exactly right. And we've found this is a good process because initially we used to just have the CJCC have a retreat and they would work on it. They'd create their action plans, and that was great. But then then the folks around the table there are often not the ones with the boots on the ground, and they don't have the firsthand perspective of what's happening currently. So we found that having these work groups really helps with giving us that insight. But also, it's a lot of work to put together these action plans, and to have all of you at this table put together 3 action plans is a lot for a group of very busy people. So we just found that breaking it up like that and also bringing in others really helps. And then also it just helps your agencies to have a better understanding of what the council's doing. It kind of helps spread the word and makes them feel more involved too, and that like they have a say in the strategic plan.
Additional questions or comments? Amy, could you just highlight the approach to priority 1 of strengthening the CJCC that is different than the 2 work groups you're proposing for behavioral health and pretrial compliance? You had explained this to me in our call last week, and I want to make sure the group here understands how we're approaching that priority slightly different.
Sure. Yeah. So the first one is strengthening the CJCC. And I just thought it might be a good idea to have this group work on that action plan together, because it's really about what you'd like to see for the future of your council. If you want to change anything about it, if you want to further focus on data or some areas like that that I had put in my report, we can talk about that as a group and learn what you're most interested in doing for seeing for the CJCC. So together we'll have at that February meeting time to really dig into that first priority and talk about potential strategies for it, see what you're interested in, not interested in, what might be new that I haven't thought of. So that will be our time to create an action plan. And those are the same action plans that the work groups are going to also create. So you're going to have a better idea of what these work groups are doing and how they're doing it. And so then that will be the action plan for that one priority, and then there will be similar action plans for the other 2. Did that answer your question, Judge?
It did. I just wanted to make sure that the group appreciated the distinction that you are the work group for the strengthening the CJCC priority, and that Amy's proposal is that we undertake that work at the February 10th meeting. And the model would mirror the same model that the work groups will use for their priorities of behavioral health and pretrial. I just want to make sure everybody caught that as part of her presentation, is that this group will do that priority. Does that make sense? Okay. Thank you, Amy. I appreciate that emphasis.
Of course. Any other questions before I move on? No. Okay. Okay, so then moving on to the mini assessment that I did. This is not it's not entirely different from what I've already done there. So it's not going to look, there's not going to be any surprises here, but I think that this mini assessment does help kind of guide the conversation that we'll have at the February meeting about ways that you could enhance your CJCC and put those strategies into your strategic plan. So I'm trying not to take up too much time, so I'm not going to go into this much, but as we talked about at the training I did last April, we're using the national standards for this assessment. It's comparing your CJCC with the ideal council. And if you need any of these materials, again, I'm happy to send that presentation or the resources from that. And these are the 10 essential elements that I presented on of a high-performing CJCC based on the national standards. And the assessment looks at all of the factors within each of these elements, and ranks your council on levels of compliance. So there's 4 levels of compliance: not compliant, somewhat compliant, mostly, and fully compliant. As a reminder, we are comparing yours with the model council. This is supposed to be considered aspirational. I know no CJCC that fits this model. It doesn't exist, but it's just something to compare yourself with and decide where you might want to make some changes. Okay. So I know this is probably too small and I will send it out, but here's how your council scored. I want to say this first. This is a very strong start for a council that's only 1 year old, because you're new and you're finding your footing. Many of these are in process and of becoming compliant. So for example, data and strategic planning elements here, they say not compliant, but by next year, they're going to likely be compliant. We're doing the strategic plan right now. So a lot of these are in process. And then a lot of these also come with age. So not even being 1 year old yet, you're not doing some of these things, understandably. For example, engaging the community is not something that a council typically does in its first year, but might begin to embrace over time. And we'll definitely talk about that as one potential for your strategic plan. So I think this assessment is perfect timing to help develop your plan. It can really inform what you might want to work on. I'm going to go over these briefly. I know I only have a few minutes, and I'm trying to decide if I should just really briefly do this. But the not compliant committee, strategic plan, data, community engagement, those are all understandable. Like I said before, you're new, so that makes sense. The systemic focus, and let me just back up and give you a quick tutorial on this chart. But the left column is the 10 essential elements. The middle column is how you rank. And then the right column is what is not present. So the thing missing from this table is all the wonderful things you are doing. It's just showing the things that aren't present as far as the factors within the essential elements. And that's just for sake of time. I'm just pointing out the things that maybe we could work on, but you guys are doing a great job in a lot of these areas. So for systemic focus, what's missing is a vision statement. This is a minor thing. Not every CJCC has a vision statement. We can talk about it, whether you want to do that or not. And then some of the systemic focus factors were hard to assess because you're so new, like maximizing resources and responding to crises. You've only been around for a year, so you haven't had to do a lot of that, though you've already shown promise, because I know, a big thing came up earlier this year and you found a way to meet and start tackling it. So I think you're already showing a lot of promise. Participation, factors not present are having a community representative, having an onboarding process for new members, publicly posting your membership information. Again, these are all pretty understandable. Leadership is only somewhat compliant, and that was a hard one to score. But the reason that you got somewhat compliant is because the factors missing are set terms in the bylaws for your chair and vice chair position. The selection process in the bylaws is a little underexplained, and then the biggest missing factor is really having a steering committee or an executive committee. I use those interchangeably. Not every council has one, but the national standards do find that councils that have those are most successful. I know my time's very short, so I'm just making sure I covered the main things I need to. Director and staff is listed as somewhat compliant. And that's because while staff has been assigned to the CJCC and doing an amazing job, it's not a dedicated position with a specific job description. And obviously Brad's working hard to keep your CJCC moving forward, but he has many other responsibilities, and the standards do call for a dedicated position. Again, this is the ideal. Not every council can do that or has the budget to do that, but we can talk about creative ways that maybe you could use staff for the council. Okay, I tried to do that very fast. If anybody has questions, please let me know. But before I finish up today, I just wanted to list some of the considerations that I found from that assessment that we could use going forward to February. And just things to think about. I will send this presentation out, and also we'll be surveying you in January about all of these things. So you'll get a chance to weigh in, let me know what you think of these ideas, give them a little consideration. But I'll just quickly highlight them here so you have an idea. So creating and adopting a strategic plan, we're already doing that. So one is pretty easy. Number 2 is establish a steering committee or executive committee. Number 3, revisit the bylaws. We could talk about things like whether you want a vision, whether you want to make the leadership terms and selection process a little more defined, institute an onboarding process for new members, meaningfully engaging the community. We could talk about what community means, who to bring to the table, how to include different perspectives, how you tell the community what the CJCC is doing, stuff like that. Posting CJCC information on a public website, creating a communications plan, including a crisis response process, developing that director position, reviewing system data regularly. That's things like the key performance indicators, which I talked about in my previous visits, and then forming committees and work groups to advance the CJCC's work, which will likely come out of the strategic plan. But if there's other work groups or committees that you think should exist beyond the 2 strategy areas, then that's a good conversation for us to have as well. Okay, so I know I threw a lot at you and I was trying to keep my time short. But are there any questions that I can answer now?
To clarify, Amy, these are the discussion points that you expect us to revisit in February as we discuss the priority of strengthening our CJCC and how we want to revisit these areas, right?
That's right. And I will also survey everybody in January just to get your initial thoughts on these ideas. So I'll give you more information in that survey as well.
Great. That'll help focus and drive the conversation then in February.
Yeah. I was hoping just to tee it up here so that you got a first impression of it and then could come back to it later.
Appreciated you letting us know where we currently stand in terms of the model council. Will you also be able to let us know which are the highest, maybe that's not the right word, but given where we are at as a CJCC, will you also be able to give us some recommendations on areas that are perhaps of highest priority or most achievable for where we are at in our CJCC lifespan, meaning a 20-year CJCC may be in a better position to have certain aspects of this model CJCC than one that is going to have an anniversary in January?
Yes, absolutely. And those that I listed, those 10, which is a lot, I realize, but those were kind of the ones I picked out as these would be good next steps for you. You don't have to do all of them, but those were kind of what I recommend. But I could easily pick out the ones I most highly recommend for you at this point in your lifespan as the council.
I know I would appreciate that as looking at all of those options. I certainly would appreciate it. I know a decent amount about a CJCC, but this is my first CJCC, and certainly we benefit from Amy and JMI's experience in that regard as to how to prioritize achievable and accomplishable approaches and strategies. So thank you for that.
Yeah.
Additional comments, questions for Amy? Thank you. Next steps, Amy?
Yep. So our next steps, I will send out this presentation and answer any questions. Please feel free to respond and ask me anything you want to give more detail. I know this was a quick presentation. The survey link will also go out by the end of this month, so you should have all of January or the first half of January to complete that. And we'll also in January request work group members from all of you. And then in February 10th, we'll have that strategic planning exercise at your meeting. And that same week, we'll have those initial work group meetings. And that's it. And here's our contact information in case you want to reach out.
Thank you, Amy. You will then share that with Brad so that he can distribute it to the members afterwards?
Absolutely.
Great, thank you.
Thank you.
Any other questions for Amy about our strategic planning kickoff and plan from next steps from here? Okay, thank you very much, Amy. Appreciate your work thus far. Looking forward to continuing to work with you and JMI as we move forward with our strategic planning.
Thank you.
If no other comments or questions on our kickoff for strategic planning, we will transition then to our diversion programming presentation. Then I will say good morning again to Andy Freeman and acknowledge our guest, Laura Ronitz from Elevate. She is the Chief Executive Officer. That one I have that from Elevate, which is our community partner for our diversion programming. They programming here in Washington County. They will be co-presenting on the topic of our diversion programming education presentation. I will thank them both in advance for their thoughtful presentation and turn it over to you both.
Nope.
There you go.
Okay, great. So while Andy gets our presentation up, I just want to say thank you. Some of you I have met. As the judge said, I am Laura Rainitz. I'm the CEO over at Elevate. We're a community resource center for substance abuse and mental health crisis in Sheboygan, Washington, Waukesha, and Dodge counties. So we run the case management of the diversion programs in Washington County. So for the purpose of this discussion, we're going to call them diversion programs, but that's going to cover all three of them. So sort of a global term for this presentation. Today I have Brooke Peters, who's our program manager, and Brenda Dunlap, who is our director of services. So to answer any questions you guys may have when we dig down. We have included a lot of information in this deck. You have it. We're going to kind of keep it top level as a refresher about this program. So the agenda, you'll see benefits and impact. I'm going to cover that, our program overview, and then hand it over to Andy to really dig in to the detail. So the benefits really of a diversion program are really threefold: reduced recidivism, positive participant outcomes, and cost effectiveness for the community. And when we say reduced recidivism, we mean less likely to commit new offenses and lower the propensity to commit additional crimes, which makes a safer community, really. Positive participant outcomes, we're really talking about maintaining sobriety longer and improve mental health, physical health, and relationships within the community. So really a more positive outlook by the participants. And then cost effectiveness, both or all the diversion program really are intended to save taxpayer dollars by diverting jail time, prosecution, all of those things to save us money in our community. So I think you can go forward. If you think about diversion programs, think about them. They are safe make a safer community, make the participants safer, and they are effective. And I want to that's what I talk about when people come up to and say, why would we do this? They're safe and effective for our communities. You can go ahead. So defining diversion programs. These programs refer to both pretrial diversion and drug treatment court. So there are 3 programs, 2 in diversion and really 1 in drug treatment. They serve a wide target of the population in all 3 programs. And we want to conserve criminal justice resources and ensure accountability for criminal behavior. So it's really a balance and it's twofold. Go ahead. And again, we have, like I said, we have 3 diversion programs: adult drug treatment court, drug diversion program, and OWI diversion programs. And Andy's going to go kind of through that matrix as we go forward. And I think I want to stop here and really talk about program partners and how important partnership and collaboration is to successful diversion programs. You can see all of the people that participate in these programs. They really cannot be successful without buy-in and partnership from everybody. And I think in this county, since I want to say 2015, well before I got to this county, these teams have been working together to really improve the process, really use best practices, improve tracking and reporting over the years. And I think it's one of the reasons it's been so successful. I work in a couple different counties and it's not always as successful with the great outcomes that you've seen here. So we're really super excited. I was very happy to see coming in that there's a mission statement around this that everyone's agreed to. And I think that's really 4 points. And if we all buy into that, I think we can see that these programs really can't miss for our community. Provide safe and effective programs is really what is really the top line. Emphasize personal accountability for the participants. I think as the service provider and case managers, we really try to focus on that on the day-to-day as they move through the programs. Focusing on evidence-based programs really is how we get great outcomes. And then reducing recidivism to increase public safety. So safe and efficient. I'm going to leave you with that. And I'll follow up at the end, but I'm going to hand it over to Andy to kind of dig in. Again, if you have questions, we're all here to answer them, so jump in. Thank you.
So these are broad goals for all diversion programs. So drug treatment court, drug diversion program, OWI diversion program. First and foremost, promote or improve public safety. What I mean by this is in the program's policies, procedures, their actions, and core components, the program should work to ensure and promote public safety. Reduce recidivism, Laura already talked about, it's a primary outcome, both in our county, at the state level, and national level. These programs are meant to reduce recidivism. Improve health and welfare of participants is, I think, self-explanatory. A tenet of these programs is that substance use contributes to criminal behavior for the individuals in these programs. So if we provide treatment and services to address the substance use, their criminal behavior will decrease, and we will also improve the health and welfare of participants. And as Laura mentioned, these programs, our goal is to maintain cost effectiveness. If these programs did not reduce recidivism and maintain cost effectiveness, they wouldn't exist. I think it's that simple. Little history of the programs. So Washington County was one of the first TAD funded sites in Wisconsin back in 2007, which I think is really important. We've been doing this for a long time in some way, shape, or form. In 2007, we started with the OWI diversion program for second offenses. Since then, 2015, Laura mentioned that's when many of those partners, there was an effort to revitalize the coordinating committee that oversees these programs, and there became a more concerted effort to update the programs, align with best practice, evaluate the programs and their effectiveness, and consider how can these programs, diversion programs as a whole, better serve our community and the criminal justice system. So in 2015, we expanded the OWI diversion program to serve third offenses. In 2017, I'm sure everyone here remembers that was the height, especially in Washington County, of the opioid crisis. So seeing that, its impact on individuals, the community, our criminal justice system, we implemented a drug diversion program at that time specifically focused for serving individuals with a possession of narcotics charge. And then in 2018, we used the reason OWI diversion transition to county funding is because we transitioned our state funding through the TAD grant, which I won't get into the weeds about funding, but we switched that to support the drug diversion program. The OWI diversion program at that time had demonstrated a significant reduction in recidivism from 2007 to present. And so we were lucky enough to transition that to county funding. 2019, We expanded the drug diversion program to include individuals charged with possession of stimulants, so possession of methamphetamines, possession of cocaine. That's also because we looked at the number of cases charged with the possession of methamphetamine or cocaine per year and said, hey, this is increasing as a way to show that it's impacting our community. So let's expand the program to serve these individuals as well. And in 2020, we implemented Drug Treatment Court. We'll talk a little bit more about why, but simply put, to have only a diversion program to serve all individuals with a drug abuse problem or primary concern is really insufficient, or it's not the most effective. Treatment courts are meant to serve high-risk, high-need individuals. Diversion programs are meant to serve individuals with lower criminal risk and less severe treatment needs. By having both, we can serve more of the population. And in 2025, most recently, in collaboration with the District Attorney's Office and Elevate, we've made some significant enhancements to our drug diversion program to update it and align it with best practices. Diversion program core components, I talk about them here because they apply to all three programs, and it would take a significant amount of time. I'm sure for those of you that have looked at the slide deck, it would take a significant amount of time to go through in great detail each program and its requirements. So I want to provide an overview of core components that are across all three. First and foremost, they're voluntary. That's to align with defendant constitutional rights and also because treatment's voluntary. They're intended to serve a specific target population. I just talked a little bit about why with treatment courts and diversion programs. Simply, they are more effective when they serve a specific target population. You can allocate resources more effectively and make sure that the program services and requirements are intended to serve that population. To make sure you're serving the intended population, we want to have objective eligibility and exclusionary criteria that's based on a validated risk and needs assessment tool. We want to make sure we're serving who we intend to serve so that the programs can do a good job. And we want to make sure that we're consistently serving the individuals that we want to serve. That's how those three fit together. In terms of programs promoting public safety, I want to be very clear that these programs exclude violent offenders. So there are federal and state statutes that prohibit programs that receive state and federal funding from serving someone convicted of or charged with a violent offense. I'll leave any further description of what constitutes a violent offense up to our legal experts here, but we exclude violent offenders with the goal of making sure that individuals that are participating in these programs are individuals whose criminal behavior is primarily the result of their substance use. By excluding high-level offenders, the diversion programs exclude individuals charged or previously convicted of manufacturing delivery, aka drug dealers. A drug treatment court excludes individuals with any offense over an F felony. So we do have eligibility exclusionary criteria that are focused on ensuring these programs serve individuals who are safe for diversion. Case management and supervision. A real key of what makes these programs effective is they have a case manager that not only meets with, supports, and monitors the client's compliance, but that also receives all the information from the service providers and reports on their progress to the criminal justice system. They are the link between our behavioral health world and our criminal justice world. They ensure that program requirements and individuals' compliance is consistently explained, and they're also there as a primary service coordinator for the client to make sure that every client gets what they need. Frequent alcohol and drug testing. It'd be weird to have, drug treatment court, drug diversion programs that didn't monitor alcohol and drug use. A primary goal of these programs is to reduce or stop the frequency of someone's substance use. And that's usually first and foremost. I'll say it here, the majority of our clients enter these programs regularly using. Regardless of what stage of the criminal justice system they're in, our first goal primarily is to help them reduce and then stop their substance use, and then focus on improving other areas. So drug testing is frequent. It is witnessed in 2 of the programs. It is randomized. And in all programs, it has the ability to be randomized. We use
Andy, could you just pause? Can't close the door.
I can talk louder.
That's what I do in court, so I encourage it. Have
All
it.
right. We use a wide range of testing also. Urine testing is often considered the gold standard. We do oral fluid testing in the OWI diversion program. Clients are on SoberLink, so a portable breathalyzer that they're required to blow into 3 times a day in the OWI diversion program. We also do fingernail testing or biomarker testing, which can detect alcohol 3 to 6 months previous. And I'll pause there. I could talk about drug testing for probably 8 hours. So that's probably not a good thing. Anyway, evidence-based treatment services, our goal is to help individuals not only stay sober, but address any needs they have and help them improve the quality of their lives. This is not just through treatment, it's through ancillary supports, resources in the community. Evidence-based treatment services also means just following what research says is best. A core example being, we know it is best practice and individuals have better outcomes with an opioid use disorder when we provide medication-assisted treatment in addition to psychotherapy. So we do that. We know that not every single individual needs residential treatment, so we make sure that a clinical assessment determines what treatment is recommended for every client. So we utilize resources appropriately and make sure clients get what they need, not more, not necessarily less. Incredibly important. Already talked about supportive resources, ancillary services. You'll see later in talking about life domain areas, participant status that changes from admission to discharge. The simplest way I can say it, many clients, their substance use has affected many areas of their life beyond the criminal justice system. We want to make sure that when they're in the program, we help them improve those areas so that maintaining their sobriety is not only realistic, it's enjoyable or positive. Because if being sober sucks, they're more likely to go back to using. I mean, that's in the most common sense way I can say it. We want to make sure that they have what they need and that continuing their sobriety is supported as realistically as possible. All programs use incentives and sanctions. That is simply to say that we use basic principle of behavioral psychology to reinforce when clients are doing what they should do. And we have consequences or sanctions when they are non-compliant. All programs do this to a greater or lesser degree. And for every program, there's a legal benefit or consequence. Probably not a surprise if there wasn't a legal benefit, no one would participate in these programs, especially in the beginning when most of them are still actively using. If you didn't offer a carrot, yeah, again, most people wouldn't participate. But for every program, there is a legal consequence if they don't complete. And in every program, there is a mechanism to return individuals that are non-compliant back to the traditional criminal justice system for a legal consequence or punishment. That is also part of ensuring the programs are promote public safety. So how do programs differ? We'll talk about this also in the next slide, but how and when diversion occurs, what target population they are intended to serve, and the associated eligibility criteria. Because they differ, how and when diversion occurs, the referral source and referral process is also different. Drug diversion program is structured as a deferred prosecution agreement. The district attorney's office has a primary discretion in regard to offering a deferred prosecution agreement. So referrals come from the district attorney's office. And also the program occurs before sentencing, as one example. Program length and requirement, because the programs serve different populations, their requirements, their length vary in intensity. so that they can serve each group or set of clients most effectively. And then the type of legal benefit or consequence also differs. This is also that we can provide diversion programs both before sentencing and after sentencing to high risk and low risk clients, and that we can do so in a way that still mirrors that sequential intercept model or the process of our traditional criminal justice system. Because while these are diversions, we still align with criminal justice principles. It still aligns with the normal criminal justice process. Why do we have 3 programs? Individuals with the substance use disorder in the criminal justice system, our goal, if we know that diversion reduces recidivism for this population, is we want to serve or provide a diversion option for as many of these individuals that align with best practice and are safe to divert as possible. So we do that by the type of offense, drug offense or OWI offense. We do that by having a diversion option for individuals with low and moderate need as well as high need. And what I was just mentioning, we have options for pre-sentencing, drug diversion, post-sentencing, drug treatment court. And then our OWI program, for time purposes, I won't get in the weeds, but for a third offense OWI, when someone enters a plea, they have to proceed immediately to sentencing. So for a third OWI offense, it occurs after sentencing, whereas our second, it occurs before. Eligibility criteria.
You have
Yeah.
a question?
Yes.
Help me understand the word criminogenic in the phrase criminogenic risk and need. I'm not familiar with that.
Yeah, excellent. So criminogenic risk is their overall risk to reoffend. Need would be their clinical need, the criteria or factors that are considered treatable or changeable that contribute to their criminogenic risk or risk to recidivate. So do they have a substance use disorder? What are their peers and social connections like, their living situation, employment status? What factors are considered changeable that we can address or that are needs that, if addressed, may change the risk to recidivate?
Thank you.
Yeah. Eligibility criteria. I put them here for time purposes. I'm not going to go through them all in detail. Drug treatment court is focused on serving individuals charged in order to, because it's post-sentencing, they have to be convicted. That's why both words are there. With a felony. Drug treatment court accepts a wide variety of criminal charges. Drug treatment court also accepts referrals from the Department of Corrections as an alternative to revocation and is focused on serving individuals with a severe substance use disorder and who have high both risk to recidivate and high need. I'm highlighting how the programs differ, which is in bold here. DPA diversion accepts misdemeanor or felony. It's focused on drug or property offenses and accepts individuals with a range of severity in terms of their substance use need, but really focuses on low to moderate risk to recidivate. And OWI diversion, both second and third are misdemeanor, any identified substance use need. And really, while we accept high risk and need, it's really focused on serving low to moderate individuals with a third when they're on community supervision. Thanks to the excellent collaboration with Department of Corrections, we can really individualize or customize the program to meet the needs of individuals with high risk and need for a third offense. General program requirements. What I really want to highlight here is that the length of the programs differs. Drug treatment court is longer than the drug diversion program because drug treatment court is intended to serve higher risk and need individuals. The frequency of case management and alcohol and drug testing also varies to match the intensity and or needs of the population that these programs are intended to serve. And then each program has program-specific requirements. I already mentioned some of the different drug testing, alcohol and drug testing components of OWI diversion. That program also focuses on helping clients complete their DOT requirements so that if they're eligible, they can obtain their driving privileges so that they can go to and from work and to and from treatment. And drug treatment court has phase requirements. Drug treatment court has curfew. It requires employment, engagement in employment. It requires engagement in community support groups. So any understanding that getting into this topic in detail could itself be an hour-plus presentation. Quite honestly, any general questions about program requirements or eligibility? No, all right. Outcomes, again, outcomes itself and everything in track could easily be an hour, 2-hour presentation. So really want to highlight main program outcomes. These are ones that are required by our state and federal funders. These are considered main program outcomes at the state and national level. We do them, we track and report them, not just because they're required, but because they are main ways of determining and showing whether or not our programs are effective. First, graduation rate. Also in the bottom, you'll notice for all the outcome slides, it says when this data is from. These numbers will change. So in the beginning of next year, at our next coordinating committee meeting, these numbers will be different. So if you see different numbers, it's because we update them. But we look at graduation. If our graduation rate is comparable to similar treatment courts or diversion programs, we know we're on par, that our programs are performing as expected. If it's higher, that may mean either we're performing exceptionally well for whatever reason, because we're great, or it may mean that a program is too easy. For example, if in our drug diversion program, we only met with clients once every other month and we only tested them 3 times in the entire program and just said, don't get in trouble, we'll test you 3 times, we'll tell you when the test is, guess what? We'd have a phenomenal graduation rate, but our recidivism rate would probably be terrible. Anyway, so we look at graduation rate, average days sober at discharge. Again, main goal of the program is to help individuals reduce and stop their use. While we look at substance use when they're in the program, the easiest measure to report consistently is how many days do graduates maintain at discharge. These are significant periods of sobriety. These are on average, but this is also significantly longer than clients are simply required to maintain in order to graduate, which I think is really important. That individuals that graduate the program tend to maintain sobriety much longer than they're simply required to in order to graduate, which indicates that they're not just doing it to check a box. It's more indicative, especially when you look at the next slides, that they've developed a lifestyle and or habits that are more supportive of their continued or maintained sobriety than simple requirement may be. Diverted jail days. Diverted jail days goes into cost effectiveness evaluation. I will be the first to say that I would very much like to do a more comprehensive cost effectiveness evaluation that includes all other factors, that being things from reduction in hospitalization, clients, what it means for clients to obtain employment, how much sooner clients obtain insurance and stop and or don't need county funded resources. There are many ways that are more complex and county specific that we could look at cost evaluation, which we hope to do. Diverted jail days and that associated estimated cost savings are ways that the state and feds measure this area, which is why it's something we consistently report. Diverted jail days is the total for the period at the bottom. It also assumes that not everyone, not 100% of individuals that graduate receive a reduction in recidivism or that jail is diverted. What I mean by that is not 100% of clients who are terminated go to jail. So we don't assume that 100% of clients that graduate will divert jail bed days. It's anywhere from 45 to 51%. So, and that's from the Wisconsin Department of Justice and their comprehensive reports. We also use their numbers if you look at the TAD 2025 report. Anyway, I can go into this in a lot more detail, but.
Andy, a couple questions for you.
Yeah.
You provide a graduation rate for these programs for our county. what do you compare those to? So we know what our rates are, but what is the standard for comparison, either Wisconsin or nationally?
Excellent question. It'll be on the following slide.
Oh,
Thank you.
So follow-up question then?
Yeah.
When you calculated estimated savings in the last horizontal entry, is that based on the diverted jail days?
So if we take 45 to 51% of individuals that graduate the program, based on the estimated jail days that would be diverted for that percent that graduate, multiplied by the average cost of a jail bed day from 2015 to 2025, then we subtract the cost to the county per year. This is the average cost savings per year,
That's annually. Thank you.
annually.
Thank you.
Yes. I include this because it was a focus, something we focused on significantly for a period, and I do think is incredibly important, especially in drug treatment court and the drug diversion program for many of the clients, or the vast majority of clients, women who had children when in the program. Had their children been born prior to participation when actively using, there's a high likelihood their children would have been born with neonatal abstinence syndrome. The impact on the child, the family, their future health is significant for anyone familiar with that. We do believe it's incredibly important to help every participant maintain sobriety, and in particular when mothers and fathers can have healthy children born in the programs. It's phenomenal to see. So I like to include that. To me, probably two of the most important sides when we're talking about your treatment court and diversion programs are this one and the next one. These are client status in different areas at admission versus discharge. I think this does the best job of illustrating that the programs do their best to support clients in improving all areas of their life, not just can you stay sober. So the blue is percent of clients that have or meet criteria in each of these areas at admission. The green is what percentage of graduates meet this at discharge or graduation. So the significant increase for graduates that have safe and supportive living, who are employed, who have income above the federal poverty limit, who have a driver's license, and who have health insurance. All of these factors support not only their sustained recovery, supports their overall continued health and wellness. And to us, that's incredibly important. The same is for drug diversion. Although you'll notice, and I think it really illustrates something, you'll notice a much higher percentage of clients in the drug diversion program have a safe living environment, are employed, have income above the federal poverty limit, have a driver's license and health insurance. A much higher percentage of these participants have that at admission compared to drug treatment court. I think that really illustrates that drug treatment court and the drug diversion program are focused on serving two different client populations. And that's why we have two programs, and their services are targeted to match each population's needs. So what do we compare a graduation rate to? Here, I don't include a national average for consistency because we have a national average for a drug treatment court. We don't have a national average for drug and OWI diversion programs. So what I used were similar programs in Wisconsin that are funded by the Wisconsin TAD grant in 2020 and 2025. So each of these reports, which are in the references list, each of these reports summarizes data from TAD funded sites in Wisconsin over the 5 years prior. And this shows how we compare to similar programs. Our drug treatment court is right on par with other treatment courts in Wisconsin. Our drug diversion program is slightly below, and I'll talk about why. and our OWI program is slightly above. Drug diversion, what I mentioned that we started drug treatment court to make sure that we had a separate program serving high-risk, high-need individuals. Because we only had one program serving the majority of that population for so many years, we would expect that if we were serving individuals that really needed and would have benefited from a drug treatment court, we would expect a slightly lower overall graduation rate. We hope to see this increase steadily over the years to come. But that is the best indication as to why. But overall, what this shows is our programs are performing on par with similar programs in Wisconsin. Our participants are able to maintain significant periods of sobriety. Our participants or graduates show improvement in multiple areas of life at graduation compared to admission. And we do, admittedly, it's on a relatively simplistic measure, but based on that measure used by the state as well, programs save more money than they cost for the county. Okay. Recidivism, main measure of the program. Do clients commit less crime if they go through or graduate the program? Drug treatment court, caveat, we do not, you've heard me say this before, probably, we don't yet have a sufficient number of clients that have been discharged or graduated from the program for 3 years for statistical significance. So please consider this a projection. You'll know, so blue is our drug treatment court and the percentage of clients that recidivate 3 years within the 3 years after discharge. We're doing phenomenal. This looks amazing. Our clients in our drug treatment court recidivate, reoffend significantly less than other Wisconsin treatment courts, than Wisconsin control groups or a similar population. How much better we're doing here is probably, admittedly, because we are doing this earlier with a lower end than we should have. So expect this to go up, but this is very promising. And I wanted to make sure to provide this for transparency. Individuals have asked about drug treatment court recidivism. I completely understand that 5 years operating a program to consistently hear, well, we can't share that yet, may give cause for concern. So I want to share this to let you guys know we're tracking it. We take it very seriously. We track it consistently for all programs, and we will continue to report it. But I also don't want to give an overly optimistic idea of how our programs are doing to maybe cause anyone to think that I'm trying to paint an overly rosy picture. This number will go up, but right now it is also promising. So our drug diversion program, so purple are similar Wisconsin diversion programs. The tan are the control groups provided by the Wisconsin Department of Justice in those reports. Our programs perform similarly overall. Our diversion program does to other Wisconsin diversion programs, or not different in a statistically significant way. Our graduates perform significantly better than other Wisconsin diversion programs and control groups, and individuals that are terminated for the same reason that our graduation rate may be slightly lower if we were serving a drug treatment court population for the first 5 years of the program, or 3, is slightly higher. OWI diversion, so this is 2 years post-discharge. This is from 2021. Green is our Washington County diversion program. Individuals that graduate our OWI diversion program recidivate less to a statistically significant degree. We've completed 2 long-term recidivism studies, 2017, 2018, and 2021. Both show this. This is consistent, and it's a phenomenal outcome. It suggests, not suggests, very, very strong indication that simply participating in the program lowers the likelihood that someone will commit a new OWI offense or any new criminal offense, and graduating reduces that risk even greater. Yeah.
Just for my background, are those numbers based on arrests or charged or convicted?
Charged. So for consistency, we are using charge recidivism. Unfortunately, we don't have a way yet, or I'll say I don't have a way yet, to gather universal, reliable information on arrests. The public source of information that we have to measure recidivism is a charged case in CCAP. So that's why we use charged, because it's reliable, and we know that every case charged is going to be there. And we could do, if I wanted to confuse a bunch of people, I know you're familiar, but then I'd include conviction too. But then we're just including another set of numbers. Ideally, long term, we would include arrest, charge, and conviction at 1, 2, 3, 4, and 5 year. We're not quite there yet, but long term, that would be the goal. This is a very rough estimate, but I've also heard the question, well, what about clients when they're in the program? Probably not. So TAN are individuals charged with possession of narcotic drugs in 19 and 20 that are charged with a new felony offense during the pretrial process. And then drug treatment court and drug diversion program are clients that are in the program that are charged with a new criminal offense. I really hope it makes sense, and simply clients that are in these programs are less likely to reoffend during the pretrial process or when they're in program compared to individuals that are in the pretrial process without any consistent services or monitoring. And I'm going to hand it back over to Laura.
Thanks, Andy. So that's a lot of information. I hope you guys are super excited about this program. I think we've demonstrated it's safe, keeps people safe, keeps our community safe, but also keeps participants safer. And it really lowers recidivism, saves us money. I think it's so unique in this community to have such a successful program with so many contributors that Washington County is doing something really special here. And we're, as an advocate in the community, thrilled to be part of it and hope that we can continue to do this work and continue to make Washington County one of the leaders in at least our state, and if not the country. So if there's any questions, we'll be happy to field them.
Thank you, Andy. Thank you, Laura. This would be an opportunity to take a moment to ask questions about the information that was presented, ask for clarification, ask for further explanation. It's a lot of information to assimilate and present in an educational format. Thank you for your time and effort in that regard.
I will also say, I think we provided a frequently asked questions document that takes you through the things that we're asked on a daily basis.
And if anyone has questions after this meeting, when you review this information, think about it more, please feel free to reach out. More than happy to answer questions. If any members of the CJCC feel that a follow-up discussion or presentation on any particular area is necessary, I am more than happy to come back and go through any of the topics in more detail. Each of them certainly could easily warrant greater discussion. So I'm more than happy to do that. These programs were created, are maintained, and are successful because of the partnership of every member and agency and department here. These programs need everyone's support in order to continue being successful and helping not only the participants, but benefiting our community. So I thank you to all of you, and please do reach out with any questions.
More just a comment. I really appreciate the comments about the rigor of the program. The 50% graduation rate would initially seem like a failure to it. They're going to lift up the national statistics as well. But actually, 1,000% agree with your analysis of it. You could raise your rates, you could pass everyone and have 100%. So that's certainly not a diagnostic of a successful program. I really appreciate that.
Yeah.
Also, the ROI, I 100% agree with you. Definitely would need to expand the cost analysis, saying that your savings are coming from not putting people in jail. I understand why it's used. Terribly flawed, right? We could just not arrest people. the district attorney could just not charge people. The sheriff could not fulfill his duties of confinement, and we'd save a junk load of money. So not a great diagnostic, but I do understand reducing the burden on the county's resources. And of course, in addition to the overall goal of providing society for our citizens that are 100% make that the key point, but I agree with all of those comments, and I appreciate you bringing them up.
Thank you.
Certainly look at for those citizens.
Yeah. Thank you.
And I dug in. They're hidden in the reference pages, but there's a tremendous amount of information state provided. I thought maybe I already had the answer. For arrest versus charge versus conviction have been addressed in those reference materials. So, actually, a lot of information, good quality information.
Appreciate your comments, all of your comments. I think you highlighting the outcome as it relates to graduation and discharge rates is an important point to make. At its face value, those numbers in other areas would look like not successful numbers, but it's a program that I think needs to be vetted. All those programs need to be vetted based upon the expectations of the programs and the accountability aspect of those programs, and then also measured based on other comparison state and national standards. Because if you are not understanding where you sit compared to best practices, which we use in order to ensure our programs are meeting accountability, recidivism standards, et cetera, you can ask yourself, is this program too easy, right? And then we're not meeting objectives of community protection, objectives of recidivism. So I appreciate you recognizing it in that regard.
Not unlike our hiring process, our initial testing process, everyone passes. It's not a tool.
You start to ask yourself a question. Yeah.
Not a tool, right? It did serve its purpose.
Appreciate your analysis.
Crime statistics are the same. You didn't enforce the law, you could have a wonderful set of crime statistics to say you have a safe. Thank you.
Other comments, observations, further questions? Yes, thank you.
Really appreciate all the work and effort that you put into this from your office to Julie. Just a couple of questions. That the programs are rigorous and they're lengthy. And I have been in Judge Gurnoff's courtroom to witness drug treatment court. It's if you haven't been, it's extraordinary. My question is upon graduation, they're extensive, they're long, they're grueling. Is there any follow-up with our graduates post and to see how they progress in society after that, the rigorous challenge of these TAD programs? And in the event that they're graduated, obviously there's private entities that people can seek counseling or professional help. Is there a mechanism that through this program, these programs that they're comfortable with, they're familiar with, they know that they can keep in touch with the TAD programs that we offer?
Yes. So I'll speak a little bit in response to those questions, and I know that Laura and Elevate also do some specific things. So for drug treatment court and the OWI diversion program for third offenses, those individuals continue on community supervision after, in most cases, for a varying length of time after they graduate the program. And so in that way, for some participants in those programs, there's a step down in terms of the intensity of the service. The programs also intentionally, well, first, I guess what I'm speaking to is to have such an intense program suddenly stop is not something we want. Our goal is to kind of taper a decrease in terms of intensity so that there's a progressive adjustment to life outside of the program for the individual because research shows that would make them more successful long term. So the programs have built in not only a slight decrease in the intensity and frequency of services, but there's also a very intentional process with the case manager, probation agent, treatment providers, the client's team, to plan for what's called either relapse prevention or just to develop a continuing care plan, so that they have a plan for continued engagement in treatment and or services on a voluntary basis. I pause with voluntary because I know for the clients that continue on community supervision, treatment may still be a DOC requirement, but there is an intentional process to help both in terms of step down and to support them in making sure they have what they need to continue in services. Drug treatment court, and so in my role outside of Elevate, we don't yet have a specific way of following. I don't take any specific action to follow up with clients. There are ways to do that, and Laura will talk about them. But primarily the way that we look at, or really right now, the only objective way we look at participants and how they perform after graduation is via recidivism. But I'll hand it over to Laura.
Yeah, I would say that's one of the advantages of having an agency outside of, let's say, a system, doing case management. We connect people with all the resources in the community, from both an advocacy or support group standpoint to Lakeshore Community Healthcare, which offers primary health, dental, and mental health, and other programs. We have a lot of different support, a number of different support groups. And so we stay connected. I guess we rely on the recidivism sort of measurement, but I would think we could look at something like that, to say how long people stay connected. It's difficult once they're out of the mandatory program, but we could probably look at that.
Sorry, Elevate also offers an event twice a year for past graduates, and many graduates stay in touch with their case manager.
Yeah.
And anecdotally, I've heard a number of times where someone who has previously been through the program, a graduate or someone that didn't graduate, who reaches out to Elevate again or their case manager again, especially or in particular if they're in need of services. And in that area, the supportive or positive working relationship that the client and case manager develop, one of the goals is that participating in the program and the support they receive is a positive experience, because research does show that if that's a positive experience, then individuals are more likely to reach out again in the future. And while it's not an explicit goal that we report on, of course, it's a goal that if individuals do need help again in the future, they're more likely to reach out, so that they can get the help they need before things get worse.
Right. Just have a couple follow-up questions, but to touch on that point specifically regarding drug treatment court, the eligibility criteria is set up such that in an ideal circumstance, a person remains on community supervision with the Department of Corrections after they have graduated drug treatment court. So they're transitioning from court-involved accountability as part of the program to then community supervision after successfully completing the program. So that aspect of it was set up. Thereafter, their engagement and in treatment or other aspects that may have mirrored drug treatment court becomes at the direction or requirement of the Department of Corrections, or voluntary at that point. So a couple of very specific pointed questions to illustrate a few points that I just want to make sure everyone is aware of. Slide or page 7, slide 14, you outline eligibility criteria and distinctions between the programs. As it relates to drug treatment court, you point out that anyone can make a referral to drug treatment court, but then you point out certain eligibility criteria. Hypothetically, if a parent or a family member makes a referral to drug treatment court, or a social worker from Human Services makes a referral to drug treatment court, does the eligibility criteria change?
No.
And who engages in determining whether a referral from an outside source or any source meets the eligibility criteria in drug treatment court?
So drug treatment court has a 2-step or really 3-step process. First, there's a legal screening process where 3 drug treatment court team members look at the referral information, which they receive and compare it specifically to our eligibility and exclusionary criteria. They respond whether or not the individual meets or doesn't meet that criteria or is eligible or ineligible. If someone is eligible, then that individual goes through an assessment which determines their risk and need. If the individual meets high risk need criteria, then the information in totality goes back to the drug treatment court team to make a final determination or to confirm the legal screening members found this individual eligible, the clinical assessment found this individual eligible. Are there any other concerns or new information or reason this individual shouldn't be considered eligible? And if all 3 of those go through, then the individual is considered eligible.
And so if the hypothetical, any one person making the referral, sends the referral in, which team members are assessing whether it's an eligible felony, where the person is not a violent offender, does not have a offense greater than a class F felony, and it's not an OWI, which team members do that?
Public Defender's Office, District Attorney's Office, and the Department of Corrections.
And then for the thank you, for the DPA program, who then is determining whether that person has an eligible offense, is not a violent offender, does not have an OWI, does not have manufacturer delivery offenses?
The District Attorney's Office.
And for the OWI diversion program, who there is determining whether they have an eligible offense and is not a violent offender?
The District Attorney's Office.
Thank you. Does it feel like you're testifying?
Yeah.
Sorry about that. Then I just wanted to draw your attention to,
Before you leave that point though.
yes,
Just as a
follow-up?
follow-up. Yep, the denial rate is fairly significant.
Yes. Oh, well, wait. So our ineligible rate is high for drug treatment court, which is indicative of, quite honestly, having overly restrictive eligibility criteria. I will say, based on feedback from every site visit I have been a part of, the feedback from the Bureau of Justice Assistance and the Wisconsin Department of Justice is that we have overly restrictive eligibility criteria. So that's why I say that. But yes, for the correct ones. I can appreciate that drug treatment court serves high risk, high need individuals. They are individuals that individuals may have the highest concern about being a risk to public safety. We do have eligibility and exclusionary criteria to try and ensure that to the greatest degree possible. While right now, yes, we have high ineligible rate.
Just for clarity, I was impressed by
Yeah.
holding it to the standard, make sure that funneling everyone. So, I was impressed by that statistic.
And you think part of the legal screen that a lot of the ineligible cases are because of prior years ago criminal history records? I think seldomly we'll get referrals from concerned family members that aren't even associated with a criminal case. So we'll get referrals with, if it's not tied, you can't get the program tied to. So I think overall the arching problem is we look at the totality of the criminal record as far as 15, 20 years ago, it still affect them depending if they meet that violent offender criteria. So unfortunately, they could have a really successful term of recidivism for 20 years, but that case is still going to hurt them when it comes to the eligibility. So I think it really just depends on what makes them eligible to see that number look put in place.
Thank you.
Thank you. Moving on to my next point. I've been asked, I've given presentations publicly on these diversion programs and looking at slides 19, 20, and it looks like it's 19 and 20. You offer outcome data related to safe living, employment, income changes, driver's license, achieving driver's license, health insurance for these populations. I've been asked publicly why these programs should care and invest in these ancillary areas for a person who has either been convicted or charged with a crime, and why any of this relates to recidivism. Basically, I've been asked, this feels like you're doing nice things for individuals in the criminal justice system. And so why are you investing county dollars in these areas, and why, and does it have any relationship to actually impacting a reduction in crime? How would you answer that question? Do those areas relate to recidivism? That's my question.
Yes. The more psychosocially stable someone is, the more access to treatment, both medical and mental health, the more access to basic resources, the more stable and secure they are, the better they will do, both in terms of recidivism and other areas of life. The safe and stable housing and basic income are I mean, that applies to, someone tell me an area of life that having those two basic securities met doesn't apply to, right? So of course it applies to recidivism also. The more stable someone is, the less likely they are to return to substance use, the less likely they are to return to criminal behavior.
Thank you. Appreciate it. I've asked some, Julie?
Well, I want to make a final comment.
Yes, please.
We're ready. I don't know, we're past time now.
We are a little over, but yes, please do so.
So I really appreciate the work that Andy and Laura put into this. Obviously, this is a lot of information. We could probably sit here for hours upon hours. Andy is one of the most knowledgeable people that I know about these types of programs. We meet every 2 weeks, and I learn something every 2 weeks about what's going on. So as he said, I think, you know, if there's continued conversation or questions, I mean, he has the plethora of information, and we'll talk to you all day long about it. I also want to acknowledge that this is a lot of work that a lot of different organizations put into these programs on top of their already very busy schedules. And I think we all know sometimes it's a lot easier to just put the cuffs on somebody and put them in jail, because it's a lot less work sometimes. But the work that people have put into these programs for the last 2 decades, I think, has been phenomenal. Drug treatment court in particular, that is a lot of work that goes into that. We have seen in the last, what they have not talked about today is our pain points of our programs. I think maybe the judge was starting to allude to that a little bit. Our job at Health and Human Services is the funding, right? We apply for the funding, we secure the funding, we assure that these programs are financially viable. And typically in my role, then we just go about and do these programs, right? But this program requires the partnership of every single person in the criminal justice system to continue those. And I think my question for this group, not today, but to think about is, you know, whether we believe that these are the programs we want to have in our community, and that we think that these programs make a difference in our community. We think from Health and Human Services that we need all 3 programs for different reasons to fully meet the needs of the community. What we want to decide is what's the right size, right? How do we right size these programs? What's the right number? What are the appropriate referrals that we can get so that we can make sure that we have the funding to support the right size for these 3 programs? And I think that is something that this group likely should wrestle with, because I think at the end of the day, we need to have a seal of approval of some type, that we all agree that no matter how hard this continues to be and how hard we all have to work at, you know, deciding the criteria and the referrals and all that stuff that I know people have belabored over for five plus years, that we all have to commit that we're going to continue these programs and continue to have those discussions. Because if we're not all in agreement and we're not all at the table to do this, on our end, we're just spinning our wheels. And we can't make it happen without all of our partners. And so I just wanted to say that, because I think that there is some value for further discussion you know, there is a quarterly coordinating committee that gets into the operations of things. And I think that there's, you know, that's a good space for some of the, you know, in-depth, you know, decisions and conversations. But there has to be something at this committee level that helps us to decide this is a priority for our community, and we're going to continue to try to support it in some form or fashion. So that's my little box of the day. So
Appreciate your comments, Julie. I think those are great closing comments to close out the presentation. Thank you to Andy. Thank you to Laura for your work and the in-depth presentation. We will add an agenda item to our February meeting to make space for additional questions, comments on this particular topic or next steps. With that, our next meeting is February 10th. I believe we've established that. Yes, Brad? Yes, I just want to make sure I have the date correct. Could I have a motion to adjourn?
So moved. Second.
Thank you. Any opposition to that? Then I will assume we're all in favor. Thank you so much for your time this morning.